When we talk about dementia, the conversation almost always starts and ends with one word: Alzheimer's. For decades, Alzheimer's has been known to be the cause of age-related memory loss. If an older person starts forgetting conversations or losing their way home, it's normally assumed that it's Alzheimer's. But what if this assumption has been wrong for millions of people? What if doctors have been overlooking a different disease, one that acts like Alzheimer's and looks like Alzheimer's, and has been silently shaping dementia research for decades without anyone realizing it? Today, researchers are sounding the alarm for a new condition called late dementia. This is short for Limbic-predominant, age-related TDP-43 Encephalopathy. Now, it's a complicated name, but a simple truth: late is one of the most misunderstood and common diseases in older adults. And understanding it is changing what we thought we knew about memory loss. In this video, we're breaking down what late dementia actually is, how it differs from Alzheimer's, why it's been invisible for such a long time, what patients are experiencing, and how this discovery could change what we know about dementia research. At first glance, late looks almost identical to Alzheimer's: increasing forgetfulness, repeating questions, getting lost in familiar areas, forgetting names, and the gradual loss of independence. To families, symptoms feel the same. To doctors, early stages look the same. However, inside the brain, something totally different is going on. Alzheimer's is caused by amyloid plaques that build up inside the brain. However, late is caused by something totally different, a totally different protein, TDP-43, a protein that involves regulating gene expression. When TDP-43 becomes misfolded, it clumps up inside of neurons, particularly those that are responsible for memory management. Now, here's the part that shocked researchers. Late is extremely common. 10% over 65 have it, and 1/3 over 85 have it. Now, this shows that it isn't just a few cases, it's millions of people who've been wrongly diagnosed. If late is so common, then why haven't we known about it? There's three main reasons. Late mimics Alzheimer's almost perfectly. The confusion, the memory loss, and the emotional changes mimic early Alzheimer's perfectly. For a long time, doctors believed that if it looks like Alzheimer's, then it is, and late has shown the flaw in this belief. The second reason is that we have no scans to detect it. For Alzheimer's, we have amyloid PET scans, but for TDP-43, we have nothing. We can't diagnose it with standard imaging. The only way until very recently to confirm it was using an autopsy, and this was done using hundreds of donated brains. The third reason is that late progresses more slowly. Late patients decline at a much gentler rate, and families describe it as a milder version of Alzheimer's. This assumption is wrong, as it's a totally different disease. This misunderstanding has affected everything from caregiving to drug trials. Here's where things get even more complicated. Some patients have both late and Alzheimer's, and this combination can be devastating. Some of the fastest declining patients are believed to have this combination. Neurologists described it as two separate fires that are burning, but when they come together, they become a blaze. And this explains why two people with the same Alzheimer's diagnosis can decline at different speed. The New York Times article highlighted several patients. Rory Hester had begun forgetting his conversations, and when he went to get a PT scan, it came back normal, which showed that instead he had late. And when doctors looked deeper, they confirmed this, and this prepared him for a slower decline. Next up, we have Neil Carey, a retired engineer whose memory had been slowly slipping away for years. Again, doctors assumed that it was Alzheimer's, but his amyloid scans showed otherwise. They realized that it's not Alzheimer's. His doctor told him it's not Alzheimer's, but it could be late. This wasn't exactly good news for him, but it showed him why he'd been declining at a slow pace and why Alzheimer's medication were not working on him. Finally, we have Laurel Scott, a patient who'd been misdiagnosed for years. Her family believed that it was Alzheimer's and shaped her life around it. It wasn't until a while later that they figured out she had late instead. Now, all of these stories are highlighting the same theme. Diagnosis isn't just a label, it shapes lives, and that's why it's important to figure out how to diagnose this disease. But what does TDP-43 actually do? Under normal conditions, it helps regulate gene activity, but misfolded TDP-43 is toxic and it spreads to different parts of the brain that are responsible for memory formation and decision making. This pattern explains why late often starts with memory loss, but the person doesn't lose their personality right away. It also explains why most Alzheimer's medications simply don't work on late patients. They're treating the wrong disease. The recognition of late isn't just adding another disease to the list, it's reshaping an entire scientific field. Previous Alzheimer's trial can no longer be valid, as many patients may have had late instead of Alzheimer's. Drugs that may have seemed ineffective could actually have been effective, but they were just used on the wrong patients. For the first time in history, there's a clinical trial specifically designed for late patients. Now, it's happening at the University of Kentucky, where they're testing a previous medication that was used for heart disease for this, as it protects neurons that are vulnerable to TDP-43. Now, we still don't know if this works, but it's good that there's been research done on it. For the first time, late patients aren't being blended into Alzheimer's studies, they're being treated as their own group. Now, what does this mean for the future? Late dementia is changing everything we thought we knew about age-related memory loss. In the next decade, dementia diagnosis will become more precise, new Alzheimer's drugs will be introduced designed for Alzheimer's patients, families will have clear expectations, and more studies will emerge regarding late. Now, this isn't a cure, not yet, but knowledge itself is powerful. Sometimes a new medical revolution isn't a new drug, but a new understanding. For years, late dementia has been hiding in plain sight. It looks like Alzheimer's, it acts like Alzheimer's, and for many years the whole world believed that it was Alzheimer's. But now the science is catching up. We now know that it's not caused by amyloid, but instead it's caused by TDP-43. Now this reveals something we've never had before, clarity. It doesn't remove the challenges of dementia, but it does give us clarity. And clarity is the first step towards better treatment, care, and research. We're living in the early chapters of a new era of dementia science, one where hidden diseases are finally being revealed, and one where families may finally get the answers that they were looking for. Beyond the medical side, this growing understanding of dementia carries a moral message as well. As younger generations age, they're responsible for caring for their elders. These diseases come with a lot of independence and dignity, and showing compassion isn't just a family duty, but a moral act of humanity.